Grovia.
Grovia Life.
Okay, hi everyone, it's William here. Welcome to Grovia Life. Today is a great day the Lord has made for you to be happy and to rejoice. And remember, you are a child of God. And so in today's episode, we are going to guide you on how to live a better life. And that's why with me here, I've invited a specialist, a medical doctor. His name is Mupenzi Peter. We welcome you, Dr. Mupenzi. How are you today?
I'm okay, sir. Thank you, Mr. William.
Yeah, so you are a doctor. Where do you reside?
Just as you said, I'm Mupenzi Peter.
Yeah.
Yeah, a doctor by profession.
Yeah.
Currently residing in Uganda. That's where I'm practicing.
Okay.
So I was privileged to have my low education here in Rwanda, but proceeded with my higher education in Uganda.
Okay.
Yeah.
And now you are a doctor.
Yes, I'm a doctor.
That's awesome. So today is a very good session because we're going to talk about non-communicable diseases, and precisely we'll be talking about the diabetes, and it's a most dangerous disease, and that's why getting some information about it is going to be super important for you. So welcome to this episode, Doctor.
Thank you.
So what is diabetes?
Diabetes, just as you said, it's a group. It's one of a group of those non-communicable diseases which affect a big number of people.
Yeah.
So diabetes in particular is high blood sugar, not controlled by the body. Just for simplicity.
Okay.
So, but you can say persistently high blood sugar.
So, which means to a layman's person like me, so in every person's blood, there should be a certain quantity of sugar, right?
Exactly.
And so if that sugar exceeds the capacity of what the body can contain, it turns out to be a disease, right?
Not necessarily.
Yeah.
Everyone, okay, there is that level of blood sugar the body can tolerate.
Yeah. But
there is when blood sugar increases beyond that level, that preset level. I don't know whether you're getting me.
I'm getting it.
Even for a normal person, we can have increased amounts of Of blood sugar.
Yeah.
But it turns out to be a disease when those increased amounts of blood sugar are not regulated by the body. Because the body in its mechanism, it has a way of regulating those high amounts of blood sugar.
Okay.
Yes.
So now, what could be the causes?
Yeah, that's a very good question. Actually, the causes will lead us to the types of diabetes. Because one of the causes, for us to understand the causes, you will excuse me a little bit.
Yeah.
We have to understand how the body functions when it comes to blood sugar.
That's helpful, yeah.
Yeah, it's very helpful. So after a meal or after eating, you will find that the blood sugar will be high. So the body will set in place into mechanisms. It will set up mechanisms to regulate those high amounts of of blood sugar.
Yeah.
So when for diabetes, the body will not be able to regulate those high amounts of blood sugar.
Yeah.
How? What do I mean? In the body, we have a gland called the pancreas. The pancreas produces a magical hormone called insulin, which is highly responsible to reduce the amounts of high blood sugar. So you will find that there is a problem with the pancreas. Now I'm back to the causes.
Yeah.
If there is a problem to the pancreas, meaning the body won't be able to produce those required amounts of of insulin.
Yeah,
that is number one cause.
Yeah.
Which leads us to the first type of
Of diabetes.
Of diabetes. That is type 1, common in children.
Okay.
So someone can be born with such a disorder to the pancreas, giving us type 1 diabetes. Or someone can be having tumors leading to a default in the islets of Langerhans, where we have beta cells which produce insulin.
Yeah.
Still, that one can predispose you to type 1 diabetes, however much you mature. Because everyone attributes type 1 to kids.
Yeah.
Another cause can be insulin resistance. What do I mean? The body produces the required amounts of what? Of insulin.
Yeah.
But now the cells of the body do not respond to insulin.
Okay.
They won't use the glucose which is within the body, so the blood glucose will remain persistently high.
Okay.
Part of the causes, some of the causes of type 2 diabetes, we have being overweight, being inactive. For you live, how do we call it? Being inactive, which a sedentary lifestyle.
Yeah.
Then the other thing, obesity. Of course, we know the causes of obesity.
Yeah.
Eating fatty foods, still being inactive is one of them.
Eating a big quantity of food.
Yeah.
Like there's no tomorrow.
Yeah.
So, I'm glad you have tackled a bit on the causes, because it's a big challenge in the communities everywhere today, because which brings me to an idea that another cause of diabetes is the increased consumption of sugar, right?
Yeah.
Yeah. So many people enjoy drinking, taking tea with 4 spoons of sugar, others put 5. And unfortunately, even coffee drinkers, they put sugar in the coffee, which is insane. But those are also causes of too much sugar in the body.
Just to put more light on that,
Yeah.
eating sugary foods in itself couldn't be the cause.
Yeah.
But how you deal with that.
Yeah.
So if at all you could eat sugary foods and exercise, meaning now the other sugar you were able to intake, now you have exercised and burnt those calories. You have exercised and burnt those calories, bringing down the sugars you took in.
Okay.
So the problem would be if you eat and you don't use.
Okay.
Yeah.
All right. So having said that, Dr. Peter, I want to ask another basic question, which I guess someone right there is willing to listen to.
Yes.
What are the symptoms and signs?
That's a good question, because after knowing what diabetes is, what causes diabetes, I don't know, we are just rushing.
Yeah.
Now we need to know how it would present. How would you tell I have diabetes?
Yeah.
Or the other person has diabetes? So we have the 3 polys: polyuria, polyphagia, polydipsia. Just to bring it to simplicity, polyuria, that is when you urinate a lot.
A lot.
Polydipsia, that's when you have unending thirst. Polyphagia, you have hunger even immediately after eating.
You feel you want to eat again.
Then we have, on advanced stage, you can have things like paralysis and numbness.
Yeah.
Some people refer to it as pins and needle sensation. You feel you're being pricked.
Yeah.
Yeah. Then we have burning sensation within the feet. So you find previously somebody was able to put on shoes.
Yeah.
But now they tell you, me, I no longer put on shoes. Why? My feet are burning. So that burning sensation.
Okay.
Yeah.
So to our viewers, I think you are being edified, because you can avoid this terrible non-communicable disease called diabetes. And before we go, I just want to ask you, Dr. Peter, what are the complications?
Complications. For us now to understand the complications, I like to put things in a simpler way.
Yeah.
Everyone can understand.
That's quite important.
So in the body, we have what we call blood vessels, and we have what we call nerves.
Nerves.
So what diabetes does, we have now deposition of sugar or fat on blood vessels, damaging them. Or we have also damage to the nerve fibers. You get?
Yeah.
So when you damage blood vessels and nerves, you're causing the complications we are going to see as below.
Okay.
because now blood vessels are responsible for channeling
Yeah.
blood, oxygen, and all the nutrients the body might require. So when we have damage,
Yeah.
that means you're cutting off blood supply,
Yeah.
you're cutting off oxygen supply.
Wow.
Are you seeing how complications are arising?
Yes.
When you damage the nerves, nerves are responsible for transmission of impulses,
Yeah.
hence the sensation and stuff.
Yeah.
So that means when you cause damage to the nerves, you are cutting off transmission. So the complications, everywhere we have blood vessels and nerves, they will be affected, because we have seen blood vessels are affected.
Yeah.
We have seen that diabetes affects both blood vessels and what?
Yeah.
And nerves.
Okay.
So in the eyes, we have blood vessels and what?
Yeah.
And nerves. Specifically, we shall talk about the retina, which is responsible for vision.
Yeah.
So once there is damage to blood vessels and nerves
Yeah.
in the retina, we shall have blindness.
Yeah.
So it is common
With the people
with diabetic people.
Yeah.
You will find that they are blind, yet they could see.
That's very sad.
When it reaches to the brain, I think you've heard of what? Stroke.
Yeah.
And remember, stroke, we have both hemorrhagic and ischemic. Hemorrhagic meaning there is rupture. How rupture arises, that deposition, you are reducing the lumen.
Yeah.
Then due to that pressure pressure increase and the pressure differences, the blood vessels end up what?
Bursting.
Bursting or rupturing.
Okay.
So once they rupture, that is now stroke, damage to the brain tissue.
Okay.
Yeah.
So our viewers, if you are a child of God, remember the Bible says, I pray above all things that you may prosper and be in good health, even as your soul prospers. God is always willing to hear you, but as a human being, you are supposed to also play a part. And that's why we are going to talk about the very last thing, how to avoid diabetes.
If at all we remember the causes,
Yeah.
it is exactly the opposite of the causes.
All right.
We said living a sedentary lifestyle. Be more active.
Be active, do exercises.
Exercise.
Every day.
Yes. You can do cardio. And remember, cardio involves running, jumping the rope, swimming.
I do swimming every day.
Thanks
and that's
to you.
why I have good health.
You're taking good care of yourself. And that is very good.
Let me tell you, Dr. Pillar.
Yes.
Before people love me, I have to love myself. So if I hate myself, I wonder if there's anyone who will ever love me.
Yeah, that is right. That
so
is
exercises.
Right. So that is one. Then eat healthy.
Eat healthy. In other words, eat organic food and healthy food. Avoid sugary food like fast food, French fries, all those things. They are sweet. And I was thinking about something, doctor.
Yes.
Every food you eat and it tastes good, it is an enemy to your body.
That's right.
And the food you eat and it tastes horrible, it is good food for your body.
Yes.
So, yeah. So
that's right. Actually, we usually discuss.
Yeah.
And there is some statement you told me of recent.
Yeah.
You told me eat to survive, but don't survive to eat.
Exactly.
Actually, I thought about it and it was very funny and true.
Yeah.
It is very true.
And so many people are addicted to food.
Yeah.
Because food is good. Food is good. That moment when you are eating, it's like you are in the third heaven. But you forget about the consequences that may befall.
And many people don't know that food is addictive, by the way.
Yeah, they don't.
Highly addictive.
Yeah.
So just a recap, eat healthy.
Eat healthy.
Exercise.
Exercise.
Then if you happen to be having diabetes, you have to properly take medications.
Take medication the right way according to the doctor's prescription.
Yeah. Then the other thing, of course, do screening.
Do screening.
You might be there not knowing that you have diabetes, yet you're having.
So it's better if you think you are in good health. It is good, but also if you can, go and do some screening.
just to end with, there's what we call people at risk, who are at risk of getting diabetes. One, overweight people or obese. People above 40 years. Though even the young generation now get it due to lack of discipline in eating. Then being overweight. Even these guys who take chronic steroid use. So. And
also what about alcohol?
Alcohol and smoking. Actually, thanks for reminding me. Actually, when you talked about everything which is sour to your body is good, I actually wanted to remind you that sometimes alcohol is sour, but it is not good to your body.
It's not good.
So alcoholism, smoking, they predispose you to getting diabetes.
Okay.
Yes, sir.
Thank you, Dr. Peter. I think it's been a great opportunity for us to hear some of the things we don't normally hear from people. But you can avoid diabetes, and it's not a good thing to have it. It's actually a nightmare. So how I pray that the God Almighty may give you a sense of wisdom so that you can engage your life, engage your body, be your help. Be your help. I'm saying this because you are the one that is in charge of your body. And I love to say this, you are the CEO of your body. So God bless you until another time. Shalom.